Day. So glad you all could join us today. For those online, I believe we have Chairwoman Gossage and Senator Steffen, and I believe Senator Holscher will be joining us, and she's on as well. So welcome to our members who are joining us via WebEx. First order of business, do we have any bill introductions? Senator Thompson.
Thank you, Madam Vice Chair. I do, and it is 23 RS 0028. And what that is reintroducing a bill that we had last year with funding for the Midwest Stem Cell Therapy Center for phase 2 clinical trials for their groundbreaking research and advanced COVID disease and also other respiratory inflammatory diseases, $500,000.
Any objection? Seeing none, that will be introduced. Any other bill introductions this morning? Seeing none, thank you, Senator Thompson. Next, we have presentation of the 988 annual report. Andy Brown, back again. Thank you for being here, Andy. Welcome to committee.
Thank you, Vice Chair and members of the committee. I'm happy to be here again. I'm going to be presenting on two separate reports. The first report is the Secretary's annual report on 988, which comes directly from KDADS. And then also there's a 988 Coordinating Council annual report that comes from the council. So for the Secretary's report, this is really sort of an outcomes-based report. It looks at what the impact of 988 has been so far. At the time that we drafted this, 988 had been operational for about 5 months, and so we have about 5 months worth of data in this report. We're continuing to gather information as we go. But I think one of the things that is important about 988 is that this is a new initiative across the country. So Kansas is sort of riding a wave of federal regulations and guidelines that are being produced by contractors at the federal level, and doing our best to keep up with call volume here within the state. So we work with Vibrant Behavioral Health, which is a group that has the contract from SAMHSA to facilitate the National Suicide Prevention Lifeline, as well as the 988 Suicide and Crisis Lifeline. So working with them, we've established call centers at ComCare in Sedgwick County, at Johnson County Mental Health Center in Johnson County, and at Kansas Suicide Prevention Headquarters in Douglas County, as well as Health Source Integrated Solutions here in Shawnee County. Health Source Integrated Solutions functions as our statewide backup center. Kansas Suicide Prevention Headquarters is the backup for Sedgwick County and Johnson County, as well as the primary call center for the rest of the state. And then Johnson County and Sedgwick County answer their own inbound calls. So on the page that has the green chart that has broad state metrics, these metrics are the universal metrics that are applied to the entire system. So each state gets a report like this from Vibrant every month. This one you can see has the December numbers in it. And our in-state answer rate for December was 91%. So our target for this first year was to try to reach 90%. We've been able to do that in a fairly short amount of time. And we're pretty happy with that. Our about 2.5, 3 years ago when we started working on improving this system, our in-state answer rate was at about 60%. And so we've made quite a bit of progress over the last couple of years. And I'm happy to say that we've reached that goal of 90%. Hopefully we'll be able to maintain that going forward, but that'll be in future reports. We also, another metric that we pay pretty close attention to is our average speed to answer. Right now, we're hovering around 20%, give or take a few percentage points, around 20 seconds, give or take a few seconds. So industry standard is about 30 seconds. So we're doing fairly well in that regard, but obviously the faster we can answer those calls, the better. So we continue to kind of monitor that and see if there's ways that we can make improvements in that. On the next page, there's a little information about the volume of the usage. So total calls between November 21 and November 22 was 21,000 calls. Our in-state answer rate, or the number of calls, that we answered during that same period of time was 17,284. So you can see we're making progress by increasing that in-state answer rate. Hopefully those numbers will start to be closer together in future years. We've seen about a 15% uptick between the November call volume from this year in 22 compared to November of 21. And so we know that there's an increased call volume that's occurring just sort of naturally with the promotion of 988 at the federal level. We are gearing up to really kind of launch a 988 campaign here in the state. When we do that, we anticipate that there'll be an additional uptick in the call volume at that point. And we do just sort of anticipate that there'll be ongoing growth as people become more aware of the 988 number. In addition, there's a little report here about the services provided in response to the calls. You can see here they've got those divided up into emergency rescue, mobile crisis response referrals, and our mental health related services. We're continuing to build mobile crisis teams out around the state using some of the funding from the 988 bill, as well as some funds that were in the governor's budget. We are hoping that what we'll be able to do is, as part of the CCBHC expansion, have those mobile crisis teams available in every county in the next couple of years. So we're continuing to build that out. And the referral numbers you can see are broken out by the call volume that are within those call centers. And so Johnson County's referring almost 1,500 over that year, ComCare around 3,000, and headquarters was just shy of 13,000. Then we're also required to report out on the grants that we apply for and receive that are related to 988. So we were awarded 3 transfer initiative grants in the amount of $250,000 each that focus on 988 readiness, improvement, and expansion of crisis services. The goal of those projects is to ensure training for all staff involved in strengthening Kansas 988 response. And the training is going to be made available to all 988 call takers, mobile crisis response teams, and staff at crisis receiving and stabilization facilities. Additionally, this will provide training for our peer support professionals that are involved in the 988 responses. We also received in fiscal year 22 a 988 state and territory cooperative agreement in the amount of $935,937 from SAMHSA. The purpose of that grant is to improve the state response to 988 contacts. And we've reached that goal of 90% for that grant. KDADS was awarded a supplement to that 988 capacity grant in the amount of $458,333. The purpose of that supplement is to expand and enhance the 988 suicide crisis lifeline activities. And we're currently working on utilizing those dollars for the program. KDADS also applied for a SAMHSA Community Crisis Partnership Grant, but we were not awarded those funds. In terms of recommendations, we feel like the current funding is sufficient because of the investments we've made so far and the demand level that we have. We seem to be able to meet that demand with our current funding. And so at this time, KDAS does not recommend any changes in funding source or amount for fiscal year '24. Simply replenishing the 988 fund up to the 10 million in SGF should meet the expected needs for fiscal year '24. So that's the Secretary's report. Are there any questions about anything in that report?
Committee, any questions? Senator Thompson, then Senator Petty.
Thank you, Andy. On the, referring to the green chart here, so everything prior to August would be the calls for, I guess, did it come in on 911 or?
No, those calls came in on the 800 number, which is 1-800-273-TALK.
Okay,
Or 8255. That 10-digit number is still available, and people can still dial that. It's still a live number. What 988 did was it created basically a transfer process so that people can dial 988 and have their calls transferred to that 800 number.
all righty.
So,
and then-
that number had been in operation for about 10 years.
Right.
prior.
And then the abandoned in-state, what is that? Is that a call that dropped, somebody hung up? I'm just,
Yeah, so an abandoned call is a call where the person on the other end of the line disconnected.
okay. All righty, thank you, Andy. Thank you, Madam Vice Chair.
Senator Petty.
Sorry. Thank you, Madam Chair. Andy, have you rolled out to 24/7 yet?
So the calls are at 24/7. We're still working on 24/7 for mobile crisis and for chat and text. But we do anticipate that we'll probably be 24/7 with chat and text by the end of this year, and this fiscal year, rather. And for mobile crisis, we're going to be continuing to roll that out, but we currently are working on putting out some grant opportunities for the CCBHCs to help build those teams and try to reach that goal.
And then on the grants that have been received for 988, are those one-year grants or those?
The TTI grants are one-year grants, and the SAMHSA grants were multi-year.
Okay. And then you mentioned about the funding stream that that your KDADS doesn't recommend any increase, but what was spent this year of the 10 million?
So far this year, we've allocated a little over 8.5, I believe.
Okay, thank you.
Yep.
Seeing no other question, oh, I'm sorry, do we have a question? Senator Gossage, Madam Chair.
Oh, there, can you hear me?
There, we can hear you. Go ahead,
Okay.
Madam Chair.
Thank you. Couple of questions. One is, of the 911 people that were hired that you said were call takers, how many of those are call takers? How many call takers do we have?
Yeah, so I don't think I have that information in this report, but we can certainly pull that information and bring it back. And it may be in the coordinating council report. We'll check there to you before we're done today.
Thank you. And can you also find out how many of the call takers were previously 911 call takers?
That would be 0.
0. Okay, I would think that the calls to 911 would have gone down when we opened up the 988 number, because they were all going to that one clearinghouse, correct?
Yeah, that's correct. If you dial 911, you'll still reach 911 PSAPs. If you dial 988, you'd be connected to the Lifeline Crisis Centers.
Mm-hmm. And so, and there's no crossover there. That's interesting. And then the other question is, in the train, I understood you to say that when a person calls 988, they are then transferred. Is that correct?
So if you dial 988, your call is transferred to the National Suicide Prevention Lifeline.
And is that done automatically, or is there a pause? What does the caller hear?
It's done automatically.
Okay, so they don't really know that they're being transferred. It just does that automatically.
Yeah, it's like a call forwarding system.
All right. Thank you, Madam Chair, Madam Vice Chair.
Okay, seeing no other questions, Andy, we're ready for your second report.
Okay. So again, this report is from the Coordinating Council. And again, it's an annual report that we'll be submitting on an annual basis to the legislature. And this one goes to the House Committee on Energy, Utilities, and Telecommunications, and the Senate Committee on Utilities. So on page 2 of this report, it provides just kind of an overview, explanation of how the program's been funded, and what the counselors and resources are used for. We do feel like this has been a invaluable resource for Kansas residents that are in crisis, and that its continued funding and support is essential to ensure that residents have access to the help that they need. There is a map on the bottom of page 2, and you can kind of see that this shows the percentage of calls that were abandoned, where, red is a high abandonment rate and the lighter colors are a low abandonment rate. And you can see that Kansas is pretty well situated in our neighboring states as having a low abandonment rate in comparison to other states. On page 3, this is just some information about how the council was launched. So after the Senate Bill 19 was signed, that bipartisan bill funded the statewide suicide prevention hotline. Governor Kelly then appointed her appointments to the council in the fall. There's a list of those appointments on page 3. You can see that they are from a wide variety of stakeholders. In the total, there's a 17-member council. 11 of those are voting members and 6 are non-voting members. The council will advise the Kansas Department for Aging and Disability Services on the utilization of funding for 988 and Suicide and Crisis Lifeline, and for 988 related services like mobile crisis and crisis stabilization. So our initial meeting was held on December 20th. We just met again last week on Friday. We're in the process of sort of developing our central documents and processes, and we'll be putting out budget recommendations each year prior to the legislative session. So then on page 4, this is an overview about the 988 network itself. As I was explaining earlier, those 988 phone calls are routed by Vibrant at the national level. It uses the caller's area code and then routes them to the nearest local crisis center, or to a specialty call center if they select options 1, 2, or 3. Option 1 is for veteran services, and we'll connect them to the National Crisis Line for Veterans. 2 is for Spanish speakers, and we'll connect them to centers that have bilingual staff. And then 3 is for LGBTQ populations, and connects them to specialized call centers for that. Calls routed to Kansas are currently answered at the 3 contact centers that I mentioned before. And HIS does work as that backup, as in case calls roll over from one center to another. All of our 988 contact centers are striving to provide quality services that align with the clinical recommendations that are approved by SAMHSA. We are also requiring them to maintain their national accreditation through one or more bodies, which evaluates the quality of their organizational policies, training programs, and service delivery. And then we're currently working on developing sort of our reporting process and what we're going to require those call centers to report to the Coordinating Council. We also are using a combination of volunteers and staff to meet the call volume and other key performance indicators related to the call center metrics. Again, those KPI are tracked at the national level and reported to KDADS, and so we're closely monitoring those. And we're currently working with Vibrant and Wyandotte Inc., CMHC, to add a 4th local 988 contact center in Wyandotte County. On page 5, this is just a fund budget overview, and talks a little bit about how Johnson County prepared for 988. One of the highlights I'd just point out real quickly is that we allocated $6 million across 3 of the contact centers. So Kansas Suicide Prevention Headquarters received $3.7 million, ComCare received $1 million, and Johnson County received about $1.2 million. And those numbers are reflective of sort of the call demand and the population numbers. So right now, we're reviewing sort of that funding allocation with the council to make sure that the council approves that. We're going to look at people's cost reports this next year. They'll actually have real figures that are based on their actual call volume. We'll be able to look at those and make some adjustments if needed. But that's, with 5 months, we had to move pretty quick. And so we put those numbers together and sent those out. Then on page 6, the last page, this looks at the 988 fund center expenses. So this isn't the entire 988 budget, but it is the expenses that have been reported to KDAD so far by the 3 call centers. You can see we haven't received an invoice yet from Johnson County, but I'm sure we'll be getting one of those soon. So we'll take a look at that when those come in. But otherwise, ComCare spent about 1/10 of their available funds so far, and Kansas Suicide Prevention Headquarters has spent about half of theirs. So we then broke down the expenses by category. And so you can see that about half the funds are being used for personnel expenses. Probably another 15% or so are being used for fringe benefits for that staff. So a significant amount of the funds are going directly to pay for the staffing of the phones. We also are covering things like computer upgrades, phone system upgrades, software that they can use to track mobile crisis teams and things like that. So there's a number of costs that are engaged there, and then there's some indirect costs for their overhead staff. But with that, I'll take any questions anybody has on that second report.
Questions from the committee. Senator Petty.
Andy, do you have a estimate on when Wyandotte Inc. is going to come on?
It'll probably be more than a year from now, unfortunately. Like it does take a while to start from ground zero and build up. Johnson County and ComCare both had a leg up in that they already had operating call centers that were hotlines. And so they just sort of built on to what they already had in terms of staff and procedures. Wyandotte is sort of having to start from scratch because they've contracted that out in the past.
Thank you.
Senator Baumgartner.
Thank you, Madam Chair. Andy, you didn't address this, but perhaps you could shed some light. Last year, when this was voted on and when it did become law, there was concern because it did barely pass. And there were a lot of concerns that came up in conference committee between the House and the Senate version and just the funding process, as well as the coordinating council. So could you share with us what steps have been taken to address the concerns that were raised at the time, to just kind of alleviate some of the fears or the very specific concerns of the formation of the coordinating council and just this process of funding 988? And I'll say that, I'll add, I've always been supportive of this, but we did hear quite a bit of concerns.
Yeah, and and I'm not sure I'm going to know 100% of all the ones you're referring to, but I do think that a large part of the concern that was initially raised was around, what the role of the telecom fees were going to be and how we were going to fund it. Ultimately, the state decided to use state general fund dollars rather than accessing any type of additional user fee on the cell phones. So we're continuing to, sort of evaluate the funding level that we're at before making any additional recommendations about funding sources or amounts. Our funding amounts were based on two things. One, the list of eligible costs that were in the federal bill, and two, what our projections were for the Kansas increase in call volume that we received from the federal government, and then also what we thought our current system was able to already answer. And so that's how we came up with sort of $6 million being needed by the three telecom center, or the three contact centers. We added an additional $4 million to help cover things like promotion of the 988 hotline to the Kansas public, mobile crisis services and expansion of those programs, and then crisis stabilization services. And those crisis stabilization services and mobile crisis services, the legislature was fairly clear that what they wanted to do is have those funds utilized for 988 callers, right? So that there wasn't a supplanting of other state general fund dollars that had been allocated for mobile crisis. So we're continuing to braid our mobile crisis programs with our Medicaid program, CanCare. We're looking to see if we can qualify for enhanced federal F-match for that. Another thing that I think was raised was concern that if somehow the state agency received funds to cover these programs, that we would stop looking for federal funds to cover those programs. I feel like we've done a very good job of making sure that any federal opportunities that we can apply for, we apply for. Especially related to both these crisis services that come after the call, as well as the 988 funds itself. We'll continue to do that and really look for opportunities that we might be able to sort of expand our program without having to increase the state general fund requirements.
Yes, Senator Baumgartner.
Thank you, Madam Chair. If I might have follow up, and I appreciate that response. I am curious, what is your budget ask for this next fiscal year, knowing that Johnson County, which makes up more than a sixth of the 6 million, you don't have what they've expended yet.
Yep.
You don't have that in that column. So what is your ask for this next year, the next 2 years, not knowing what that is, and also keeping in mind the ask to expand to Wyandotte County?
Yeah. So for fiscal year 23 and 24, we're not asking for any increases.
Andy, just a couple of follow-up questions from what's already been asked. So you've given us the volume and those overall usage statistics, but do you break down by call? For example, how many Kansans that called 988 were, contemplating suicide or other issues? Do you kind of categorize those? And if so, is that data available?
So each contact center sort of tracks that information independently, and we don't yet have a universal system set up for tracking it. One of the things that they're working on at the national level is a unified platform. And we're waiting as a state for the opportunity to evaluate what they develop at the federal level before we invest in anything at the state level. And I think that's just good stewardship of our funds, is to make sure that if we're going to be provided something free by the federal government, that we take the opportunity to evaluate that before we, launch a software development program of our own. But we can inquire essentially about those types of issues and determine like how many referrals were made to different types of providers, what kind of presenting issues callers had. So we can certainly look at those kinds of things if there's interest in the committee in knowing those.
I think so. I think that would be helpful going forward as that's collected and as that's pertinent. And I think I would appreciate having some more information on not just the usage, but what types and how effective we are in getting services. It sounds like the call time and having those mobile crisis centers are going to, you would naturally assume that would help. I would like to be able to have more information, to have a narrative that if they are or aren't, and what can we do to strengthen that. I guess my final question is, I'm curious about the abandoned calls. So if a call is abandoned, is there any follow-up? Is it, I mean, I'm just thinking through that someone who's in a crisis situation and is having second thoughts and they call and hang up or call and hang up. Is there any follow-through on our end with those abandoned calls?
So there's two layers to that question, right? So there's at the national level, when a call is abandoned prior to it being connected to a call center, there really isn't a way for us at the local level or the state level to be able to identify anything about that caller. So those calls are usually lost, but that's a relatively small number. The abandonment rate that you see on our list is really the folks that have abandoned between the time that they were transferred to a Kansas call center and the 30 seconds that it takes for us to answer that, right? And so those folks, our local call centers would receive information potentially about their phone number that they were calling from. And we're currently developing what our follow-up protocols are going to be for that, both for folks that have called the number and for folks that stay connected, right? So we want to do follow-up really with almost 100% of our callers at some point. Right now, I think we're doing it with about 25% of our callers, and it's largely based on, if they've volunteered into a follow-up program. So we're looking at ways we can kind of increase that and expand it. Follow-up's an important evidence-based practice. The more contact that we have with a caller, the better their long-term outcomes are. And so we're really looking at how we can address that. And again, it's part of the call volume mix. Like we have to identify, how many people are needed on shift in order for us to be able to do those follow-up calls the following day.
Senator Baumgartner.
Madam Vice Chair, your question made me think of something. Okay, you had indicated, Andy, that the routing is based on the area code. And so when I think of our college students and our out-of-state students coming in, calling through, and their cell phone came with them. Mm-hmm. So they're routed, if it's a student from Texas area code, they're routed through Texas.
Yeah, that's the way the system currently works.
And then they're kicked to us when they identify, oh, you're at the University of Kansas in Lawrence or something like that. So it's not by the cell tower.
Not currently.
That pings, but it's by, interesting.
Yeah.
So that adds to the time and the wait.
It does, and it's one of the things that the national folks are currently evaluating is whether or not they can switch to a geolocation instead of using the area codes and prefixes. But right now, if a call goes out of state because of the area code, that caller gets connected to, like in Texas, it would probably be the Harris Center or someplace like that. That center then, you can kind of triage that call, find out where that caller is calling from, and then connect them back to Kansas resources. And we also, when we receive calls from out of state, we usually advise people to start dialing at a local level. So we can, if we have somebody here from Texas, we can have them dial ComCare's local number to connect directly to ComCare, rather than going through the 988 system.
I guess, Madam Chair, Vice Chair, it would be nice if we could be kept updated on that. I see for the state of Kansas, two problems. One, our military and military families, because we have several locations where they're residing. And I see that, and I think of that not just those that are serving in the military, but I do think of their families. And we've heard repeatedly about the mental health issues that their children in particular are dealing with. And so most of them are coming from out of state, as well as our college and university students. And what comes to mind is we know that we have a very large out-of-state population attending our private colleges and universities in our state. And when our technical colleges and our universities, our public Regents institutions are allowing out-of-state students to pay in-state tuition, that is drawing more out-of-state students as well. So one thing I do know in working with young adults that are having a crisis, 30 seconds, when they took the courage to pick up the cell phone and dial those 3 numbers, another 30 seconds or 45 seconds seems like hours. And so it does concern me that we will drop them or lose them. So if you would keep us updated on how that is moving along on the federal standpoint, and who are the key decision makers on that? Is it going to be what's happening in Congress, or is it going to be a federal agency? And what input can we provide? Because I think, again, those of us that have military bases and have a lot of colleges and universities, that's a stumbling block. So thank you. Thank you, Madam.
Senator Thompson?
And as usual, Senator Baumgartner brings up so many things and conjures up a question for me, which is, on the 988, they have 3 menu options. And again, it's very impersonal. I think if somebody's calling, they're in crisis, they want to talk to a human now. And then let the human sort it out between military or Spanish speaking or whatever. Because I've had personal situations like that over the years. And first of all, somebody who's suicidal, a lot of times they're not going to talk. And when they are ready to talk, it's bad. So any delay at all is critical, I think. Thank you.
Thank you, Andy. And from what I hear, I think we all want to make sure that we get help to those individuals in crisis as soon as possible in any way that we can provide that input to make sure that that's happening. I think we're all willing to do what is necessary. So thank you for the reports, committee. That concludes our agenda for today. We will meet tomorrow and Thursday. And with that, we are adjourned.